Over time, Wisconsin's become warmer and wetter. Warmer weather leads to earlier tick activity in the season. It also increases the chance of Lyme disease here in the state.
Lyme disease is spread through the bite of an infected black-legged tick, also known as a deer tick. In Wisconsin, we have cases of Lyme disease reported in every month of the year, but the number of cases is highest between the months of May and October. Early symptoms of Lyme disease can include a fever, headache, fatigue, and sometimes the characteristic bullseye rash. But that bullseye rash only occurs in about 70% of cases. Patients treated promptly with appropriate antibiotics usually recover quickly and completely.
Local health departments are responsible for doing a lot of the case investigation that we use at the state level to get an idea of Lyme disease activity. They in turn look to us for guidance on best prevention strategies and treatment strategies, so it's a very strong partnership.
Lyme disease is a reportable condition in Wisconsin, meaning that when healthcare providers find clinical evidence of Lyme disease in a patient, they have to send a report to the health department. Every Lyme disease report is used to strengthen county data and to paint a better picture of Lyme disease statewide.
The Wisconsin Environmental Public Health Tracking Program hosts data on lots of different environmental health topics, including Lyme disease. So the Lyme disease data that we receive are your data. They've come from your community, and we pull them into our data portal. The portal is free to use and anyone can access it. Anyone can pull up data for their county, and they can look at data over time or can see how they compare to other counties in the state. In the past, we might have to look at these data in a spreadsheet, but that doesn't help us too much to be able to visualize and interpret the data. Having them in this visual medium where we can look at maps and charts and everything's together in this portal, it just makes it easier than ever to use and access.
After reviewing the data, they can get a good feel for what Lyme disease has been like in their county over the past few years. And then the data contains a link to the Climate and Health Program's Vector-Borne Disease Toolkit. And that toolkit contains different strategies and message maps that local health departments can use to get out the word about Lyme disease and help people protect themselves.
Wisconsin healthcare providers and local health departments work hard to collect the highest quality data on as many Lyme disease cases as possible. One way that communities can improve their Lyme disease data is to educate everyone from citizens to healthcare providers on Lyme disease risk, symptoms, and diagnosis. To stay up to date on the latest information about Lyme disease and other tick-borne diseases occurring in Wisconsin, please visit our website.